Hi, my name is Milan Trisna, and I will be presenting nurse case management on congestive heart failure for Cal State San Marcos, Nurse 442, nursing care management of vulnerable patients. So patient profile is Mr. JC. He's a 68-year-old African-American tall male. He's married with 2 grown children. He lives at home with his wife, and his children live close by him for good support. He was a former math teacher at a local high school, but he lost his health insurance due to losing his job. His medical diagnosis is congestive heart failure. He takes 40 milligrams Lasix PO daily and 12.5 milligrams metoprolol PO daily. A couple nursing diagnoses for him would be activity intolerance related to shortness of breath, weakness and fatigue, excess fluid volume related to impaired excretion of sodium and water, and cardiac output related to impaired cardiac function. Some key nursing interventions would be including administer supplemental oxygen to help with the shortness of breath due to ischemia, assess vital signs, urine output, and auscultate heart and lungs. Prior to administering medications, assess blood pressure, heart rate, and rhythm. Educate patient on diuretic therapy to decrease preload volume and educate on beta blockers to decrease workload of heart. And learning needs and educate patient on signs and symptoms of worsening and when to seek medical attention. So clinical judgment of comparing self-capacity with chronic illness and treatment demands. So Mr. JC's high level of self-care capacity. He's able to carry out his ADLs without any assistance, and he's also able to help his wife. The patient has been very compliant with medications, diet, and exercise, but since he was unemployed and he lost his health insurance, he was unable to afford his prescription medications that weren't covered, so that resulted in an episode of exacerbation. Mr. JC is in current process of obtaining his health insurance. He will definitely need a follow-up appointment with his primary care provider and cardiologist once he's discharged. He will also need medication, understand medications and side effects, and comply with medication adherence, so just reinforcement of that. We want to remind the patients to stay on a low sodium or cardiac and fluid restriction diet. We want to encourage daily activity, daily weight monitoring, and have them recognize signs and symptoms of worsening condition, and we'll seek medical attention if indicated. So priority patient issues for discharge planning. He only had a couple, just lack of insurance to pay for his prescriptions and insufficient funds for medication, as patient is currently unemployed with no health insurance. So out-of-pocket costs were very high. So he has the potential for ineffective coping related to disease process, possible depression due to being vulnerable, feeling vulnerable in the hospital. Clinical judgment about where patient can be discharged. So since the patient is very high functioning and is able to provide self-care, and he lives at home with his wife, and his children are nearby if he needs any help. He also has easy access to transportation and can get around very easily. The patient actually drove himself to the emergency department, so he does have his car. He will need a case manager and social worker involved to help with his finances and obtain his health insurance prior to discharge. Definitely follow-up care with primary care provider and cardiologist, and review of medication, teaching, and education. Patient will be able to be safely discharged home. Priority NCM strategy at the patient level and system level. So at the patient level, Mr. JC insisted that he would stay on track with his condition, as he felt like he was really vulnerable being in the hospital and never wanted to be back in the hospital. So he indicated that he's definitely going to stick to his low sodium cardiac diet and fluid restriction diet, which will allow the patient to establish healthy routines and kind of continue what he was doing before he was laid off. Mr. JC will also continue on with his daily exercise once discharged. This will get the patient back to his baseline before he was laid off, like I mentioned before. System level, case management will make sure the patient is discharged with health insurance so he can pick up his prescriptions at no cost. He won't have to pay out of pocket. Classes will be provided for him if he needs any additional support at any time. So intervention for the strategy level NCM, or for the patient level NCM strategy. So health promotion concept can be applied to this case study. According to Lukin's chronic illness impact and intervention, health promotion involves individual behavioral change and environmental support. Nurses, as well as family members and obviously other members of the healthcare team, like physicians, should be actively involved in patient interventions to promote patient self-care management. The nurse should actively listen to the patient's concerns and needs and educate the patient on the importance of always having health insurance and provide resources if he ever comes up to the situation again. He knows who to contact or call. We want to always involve patient's family member in educating of chronic illness and provide ongoing assessment to determine compliance, support, and education. So intervention for the system level strategy. According to Nicholas, monitoring of patients with chronic heart failure requires recognition of disease management programs. For such patients need to be multifaceted with intensive patient education, optimization of the therapeutic regime, and ongoing surveillance. So health insurance must be obtained. That's the main thing before discharge. We want to make sure that the patient's able to obtain his prescriptions and understands how to take his medications before the discharge, which the nurse can explain to him, or pharmacist. We want to arrange for an appointment with primary care provider and cardiologist for follow-up. And we want to locate resources in the community and support groups if the patient wants to have additional assistance with his chronic condition. So utilization review, it's a safeguard against unnecessary inappropriate medical care. It allows healthcare providers to review patient care from perspectives of medical necessity, quality of care, appropriateness of decision-making, place of service, and of course, length of hospital stay. For Mr. JC, the UR nurse would assess and review, obviously, his lab, tests, telemetry monitoring, IV medications like Lasix, respiratory and nutrition services, and the length of stay. This is important to review as it helps to decrease costs and improve overall health care. We want to make sure that the patients, physicians are talking to one another so they don't order the same lab tests or the same, chest x-rays or anything, so we're not having the costs too high in the hospital. Quality and safety issues. So core measures is a huge thing for congestive heart failure. We would definitely want to ensure that patient's history is accurately taken, like the allergies, past and present medical history, all home medications. We want to make sure that medication safety in regards to correct dosing per doctor's orders, ensure that the patient is capable to self-monitor all his symptoms of CHF. We want to ensure nursing procedures were accurately performed according to standard protocols, like I mentioned, the core measures for congestive heart failure, and following up with discharge instructions. We want to make sure a safe transition from the hospital to the home, and proper documentation to support core measures were fully met. NCM effectiveness on a patient level. So Mr. JC received Medicare health insurance. He returned to participating in healthy behavior, including adhering to his diet and walking with his wife for at least 45 minutes a day. He also joined a fitness center and attends exercise classes 3 times per week. So he definitely increased his activity levels. He learned the importance of medication and incorporates alternative and complementary therapy like yoga and acupuncture. He participates and volunteers in educating his local community center on how to deal with CHF as a chronic illness. And he uses his phone and logs in to document his daily weight and fluid intake per day, as well as his urine output, so he can see if there's any major changes that occur. So NCM effectiveness on a system level. So this determined that the patient was stable enough and safe enough to drive his own automobile from the hospital to home. Due to the patient's age, he was able to receive Medicare. His hospital finances were covered, as well as prescription medications. So the insurance covered also for home scale, so he can weigh himself every day and document. And refers to a cardiologist to have been performed for routine yearly assessments. We also provided the patient with contact information and phone number in case of any questions in regards to his health. So this is my references, and that is all. Thank you all for watching.